Properties of bone graft. This is an important topic for postgraduates. So when we talk about properties of bone graft, we talk about three properties primarily. It is osteogenesis, osteoinduction, and osteoconduction. Osteogenesis is the ability of the cellular elements within a graft to survive transplantation and synthesize new bone. What it basically means is the graft should be able to supply cells which directly lead to bone formation. Examples are bone marrow and cancellous graft. By osteoinduction, it means the ability of a graft to recruit host mesenchymal cells into the graft that differentiate into osteoblasts. So the graft should induce the recruitment of host mesenchymal cells and their differentiation into osteoblasts. The best example of osteoinduction is demineralized bone matrix. Osteoconduction is the ability of the graft to facilitate blood vessel ingrowth and bone formation into a scaffold structure. So the graft acts as a scaffold into which the blood vessels grow. Now these blood vessels bring with them osteoprogenitor cells which lead to bone formation. An example again of osteoconduction is cancellous graft and calcium sulfate and phosphate bone graft substitutes. Bone graft has two more properties. The first is mechanical property and the second is vascularity. By mechanical property, we mean the structural integrity of the graft, that is how strong the graft is and how much load can it resist. Cortical graft like the fibula strut graft is an example of a graft with excellent mechanical properties. Whereas vascularity is whether the graft has its own blood supply. And the example are vascularized graft, among which the fibular vascularized graft is the most popular example. Coming to the individual properties of autografts. Now most of these grafts will have a mixture of all these properties in different proportions. If you see bone marrow, it has more or less only osteogenic properties. A cancellous autograft has good osteogenesis and good osteoconduction with a decent osteoinduction and mechanical properties. Cortical autograft has excellent mechanical properties and a relatively less amount of other properties. Whereas a vascularized graft will have good osteogenesis, good osteoconduction, fair induction, excellent mechanical properties, and good vascularity. So a vascularized graft will have almost all the properties of a graft. No other graft will have vascularity. However, vascularized grafts are difficult to harvest. So the most commonly harvested graft is the tricortical iliac crest graft, which has both cancellous and cortical part, giving a good mixture of properties. Coming to allograft. Allograft will have no osteogenesis as it is freeze-dried. The other properties of cancellous and cortical allografts will be similar to their autograft counterparts. Demineralized allograft, however, will have excellent osteoinduction. Coming to the properties of bone graft substitutes. The bone graft substitute with excellent osteogenesis is bone marrow aspirate. Osteoinduction, demineralized bone matrix has the best osteoinduction. Also, BMPs are very good osteoinduction. The commercially available BMPs are BMP2 and BMP7. This can be sometimes asked. Gene therapy is another substitute which has osteoinduction. In osteoconduction, we have to remember the C's, the calcium sulfate, calcium phosphate, collagen, and ceramics. Other examples are bioactive glass and synthetic polymers. So this was a presentation on bone graft properties and bone graft substitutes. Please hit the like button if you like these videos and subscribe to the channel for further videos. Also suggest topics to be covered in the subsequent videos. Thank you.